periodontitis, how will it affect your heart? So in our studio today we have periodontist Dr. Firzana and also cardiologist Dr. Ishira. Hi doctor.
Hi, good morning.
Pleasure to meet all of you.
So to help our viewers understand more about this topic, let's watch a video that we already prepared.
Hello.
Good morning. Miss Lisa. Okay, so today, can I know what is the reason why you come to the clinic?
My reason to come to clinic is that my gum split when I brush, and it feels hurts when I touch it, and my teeth look longer than before.
I've seen your X-ray, so I can confirm that you have periodontitis. So I think we need to do some treatment about that.
Okay, but doctor, as you know that I have heart problems. I've read some articles that say periodontitis can cause heart problem. Is it true, doctor?
So from the video we can see that this patient experienced both periodontitis and heart problem, and she had been asking how can we relate these two problems. So to start off, Dr. Firzana, can you tell us about periodontitis?
Okay, periodontitis is actually one of the disease of the oral condition. It is actually the inflammation of the tooth structure that holds the tooth inside the tooth socket. So what happens is in periodontitis, these tissues are inflamed, and it is actually caused by bacteria that can be found inside our own dental plaque. So the risk factor for this disease is patients who are smoking, and of course those have systemic disease such as diabetic mellitus.
So how do actually periodontitis causing heart problems?
I think it's based on the same risk factor, smoking, diabetes mellitus. Correct me if I'm wrong, Dr. Ishira?
Yes, that's true. As we all know, smoking, diabetes mellitus, obesity and lack of exercise can actually lead to heart problem. So even though some past studies have not supported the relationship between periodontitis and coronary artery disease, which is heart disease, some recent studies have concluded that periodontitis is a risk factor for coronary artery disease. Most patients who has coronary artery disease have periodontitis.
So doctor, how do we prevent periodontitis from increasing the risk of coronary artery disease?
Since we already know that periodontitis is a risk factor for coronary artery disease, we have to take preventive measures. So to prevent coronary artery disease, we have to first manage the risk factor first. So in this case, the patient has to undergo periodontal treatment first.
Okay, so for the periodontal treatment that we as the dentist provide, okay, first of all, we are going to examine this patient through a thorough periodontal examination. So after the examination, if we have confirmed that if the patient has periodontitis, we will move on to the non-surgical method, which is the scaling and root planing. This is to remove the calculus that is causing periodontitis to this patient. And then after the visit, we will give the patient some medication in order to improve the condition of the surrounding structures. Then after that, they will have another visit where we are going to check the pocket depth of this patient. If the pocket depth is improved, or a patient doesn't have any more deep pocket, which means that the patient is no longer on the active state of the disease and should proceed with the preventive treatment instead, such as brushing technique, oral hygiene care. What if this patient still has this deep pocket? So we have to refer him to the periodontitis in order for them to have a much more invasive method of removing this causative agent of periodontitis.
Okay, thank you doctor. So viewers, we already listened to this explanation from our professionals today. I hope that our viewers can benefit from today's show. So see you guys again until next show. We're going to come back with new cases. Take care of your teeth, and then we take care of you.